Hi everyone, welcome to Therapy Talk. I'm Michael Baltimore. Today I want to talk about clinical supervision. It's one of the most important parts of training, and even after training, once you're a professional in the field, clinical supervision is a lifelong experience. And one of the things that I've discovered in our training program is that we don't often prepare students to truly use supervision in the best possible way. So I've come up with a list of 20 guidelines for supervision. So I want to spend a little time today and just go over this list with you, especially for those students who are starting practicum and about to begin their clinical experience. Our students, but also maybe other students as well around the country. Hopefully this will be helpful to you. So I'm just going to march through these 20 items or 20 guidelines for clinical supervision. The very first one is be prepared for every supervision meeting. You know, spending time preparing for supervision will give you a greater opportunity to make use of that supervision session and to enhance your professional growth. Give thoughtful reflection to your clients, the work that you're doing. Bring questions to your supervisor related to the experience and to the issues of clinical supervision. Number 2, use the skills that you've learned. Basic helping skills are fundamental in building relationships, and this includes not only working with clients but working with the staff at the clinical supervision site, working directly with your supervisor, university faculty, and on. So listen carefully, reflect on what you've heard, be thoughtful in your comments, and respond empathically using those basic helping skills. Now, build a positive relationship at the beginning. Now, this holds true for any relationship, especially that applies to one with your clinical supervisor. Be prepared to learn, to question, and to further your clinical knowledge based on a good supervisory relationship. Now, here's number 4. Be prompt. Now, always be on time for your supervision meetings, just as you would for the clients that you see. If there's an emergency or a delay, call in advance. The courtesy for your clients, colleagues, and supervisors really shows professionalism. Here's another one. Record your sessions and have tapes ready for supervision. While this is difficult, recording your sessions is required and is fundamental to receiving appropriate supervision. Practice recording ahead of your sessions, making sure your equipment works. Importantly, listen to your tapes prior to turning them in to your supervisor. List questions from your tape for the supervisor. Now, here's number 6. Be open to feedback. You know, during supervision, you will receive positive and critical feedback to improve your counseling skills. Be open to looking at yourself in this process. Use the evaluation process to improve your work. Here's another. Prepare questions for supervision. I mentioned this a moment ago, but different questions from your tape sessions should reflect the larger process of the clinical experience itself. This may include questions concerning your site, concerning administrative issues, orientation, interventions, and other questions about self that reflect your professional growth. Develop your theoretical orientation. Now, this is a process that goes on for quite a while, but give thoughtful reflection to your personality style, the counseling theories that you've learned, and develop your theoretical orientation this is an essential component of becoming a professional. Supervisors will want to observe your counseling approach based on sound theoretical principles. Be prepared to answer questions concerning your approach as you present cases in supervision. Now, here's number 9. Work for the client. It's important to make your major responsibility that of working for your client. While you're developing your professional skills, there's an expectation that you will help your client. Consider this often. Now, here's 10. Be professional at all times. Adler once said, act as if. While it's true that you are a counselor in training, it is expected that you offered the very best of who you are in a professional manner while you're at the site. but this also holds true for supervision and any relationships at the university and the community. Number 11, know your ethics. Reread your ethical standards and know them well. You will be called on to provide some ethical responses to clients and supervisors. This cannot be stressed enough. Now let's move on. Here's number 12. Consult with other professionals. The suggestion includes talking with colleagues, staff members, and supervisors as a means of enhancing your clinical judgment for your clients. Ask questions. Read and continue your studies. This is central for improving your skills as a professional counselor. There's much to know about being a professional helper. Being current by reading the literature, including professional journals and books, is required for your career training and after your school experience. Know that supervision is necessary and valuable throughout your life and your career. All counseling professionals require ongoing supervision in order to maintain the quality of care for clients. Look forward to supervision and the learning process. Here's 15. Know that problems occur and should be worked through. Know the difference between personal reactiveness and professional matters. Be assertive yet compassionate in your dealings with others. Also know how you use your own defenses and work towards successful resolution of difficulties during practicum and internship. Number 16, reflect on your personal background. Seasoned clinicians know that their family of origin and their professional backgrounds affect their clinical work. Understand also that your understanding of a clinical case is based on your personal perceptions. Supervisors can help with when bias comes into play in your clinical work. Here are a couple of very important points. 1, be flexible. Understand that becoming a professional helper requires your ability to understand that situations change. Before getting emotionally involved with matters that affect your professional growth, use supervision for a better understanding. Be willing to look at your own clinical thought process. Have fun. It's essential that counselors use humor in their practice. At the same time, students should really limit the use of humor in their clinical work. The caution here is that too much humor may be problematic. Number 19, work hard. Use your time wisely. Practicum and internship are important for setting the stage for the rest of your clinical career. Be creative in the learning process, and while under supervision, try new things to improve your clinical work. And finally, number 20, be organized and record your time. Keep good records of your clinical work on the site. Maintain a file for all of your activities and all of the log forms and other forms that you use in supervision. Well, I hope this has been helpful to you as you reflect on, and for those of you who are about to start clinical supervision, but also those of you who are in your clinical practice. I'm hoping it'll be helpful to you, and thank you for listening. This has been a session of Therapy Talk focused on clinical supervision. I'll see you next time.